Hello and welcome to this session on numbers and what do your numbers tell you? This is part of the series of sessions that we've got in this project about your health, your well-being and your numbers. My name is Helen Donovan. I'm one of the associates in nursing working with C3 Collaborating for Health. And I'm also doing this work alongside another colleague, another associate in nursing, Lola Kahendi. This work is being done alongside North Central London, ICB and Wellbeing People, and we've got funding from the Burdett Trust for Nursing to do the work. You can hear more about how the project is and what the project is in the introduction webinar. So today I'm going to be talking about numbers, and we hear numbers all the time when we have a health check. We'll get a blood pressure, we'll hear our weight, we'll hear maybe something called a BMI, we'll be given advice about what we should eat and what we should drink. What do they all mean? So that's what this session is all about. And understanding our numbers will help us manage our overall well-being and improve our health if we can improve what our numbers are telling us. So what is our blood pressure? What is your body mass index? What do they all mean? What does it mean to eat healthily and 5 a day? Hydration, really important that we drink enough fluid. I'm not sure about you, but I often get a headache if I haven't had enough fluid during the day. And that's quite common. So make sure you drink enough. We're made up as human beings of about 60% water. So again, you've got to make sure that that is maintained. Being physically active. Now, obviously, going to the gym, going for a run, those sorts of things are great. But it's really more about being physically active over the course of a day and a week so that you're keeping yourself moving. And I'm going to talk about that a little bit more. And then what do we mean by moderate alcohol consumption? So 14 units a week. And what does that actually mean? So really important for us to remember that small changes help, and it's about maintaining that healthy lifestyle. So the well-being check. For some of you, you may have had the experience of the health kiosk, which is run by Wellbeing People. This is part of this piece of work. And that will go through a whole series of questions about your lifestyle, but it'll also give you information about your body fat content, your BMI, your heart rate, your blood pressure, and you will have been given a check with your heart health MOT results and your actual age compared to what we've called the well-being age. And I know a lot of people get quite worried about that because the well-being age will always be a little bit higher. Now, obviously, this person is very fit and well. It actually happens to be Lola's well-being check, and she's doing really well, even though her well-being age is a couple of years older than her actual age. She's doing really well. She's within 5 years, and that's what the guidance is. So if you're up within 5 years of your actual age, you're doing really well, and the advice would be to keep doing what you're doing. If you're between 5 and 10 years, then that sort of shows that there is some room for improvement, and there are some things that you can do about your lifestyle that will improve your overall health. And obviously, if it's over 10 years, then you really do need to think about changes to your lifestyle, but also maybe going to see your GP or getting some more support to make sure that you reduce your blood pressure, for example. But reducing your blood pressure, reducing your weight, sleeping better, finding time to relax will all help. There's another tool that you can look at. I've put on the screen here. It's the NHS Calculate Your Heart Age, and it does a very similar thing. So what is your blood pressure? The blood pressure is the force that's exerted by your blood against the walls of your arteries, which is one of the major blood vessels in your body. So we have two figures here. We have our systolic top number, and that's the pressure as your heart contracts, as the blood vessels contract. And then the diastolic pressure, the bottom number, is the pressure as your blood vessels relax. Now, around 50% of heart attacks and strokes are associated with high blood pressure. And what's quite dangerous is that you won't know that you've got blood pressure just by symptoms. You'll only know if you go and get a check done, because you don't really get symptoms from blood pressure. Certainly not at the lower rates. Sometimes if it's really high you will, but then that's an emergency situation anyway. So you won't know if you're walking around with just high blood pressure. So you need to get the check done. And this is what we're talking about. So if we think about blood pressure here, you've got you've got the normal rate, which we normally like to arrange in this column here. But 120 to over 120 over 80 is considered to be a normal blood pressure or just below. Once it starts getting over that, then there's signs that it's slightly elevated. So we talk about pre-hypertension or elevated blood pressure when the blood pressure is going up to 140 or 140 over 90. Once it starts going over that, then the advice would definitely be that you need to go and see your GP and maybe go on some medication to help lower your blood pressure. Body mass index. Now, body mass index is just an indication of the ratio between your height and your weight, and it will be different for everybody, and different ethnic groups have different body mass index aims to achieve, because it's all based on the risk that you have of having a heart attack or having a stroke. And what we really want to do is to make sure that we have a normalish body mass index. So aim for around 20 to 25. And then obviously if it starts going up, then you probably need to do something about trying to lose some weight. But it is just a guide. It doesn't take into consideration if you're particularly muscly, for example, because muscle is often heavier than fat. So it's going to skew the results. Same with bone density. So just use it as a guide, but give it as an indication if you are creeping up and your weight needs to come down a little bit. Alcohol units. Now, alcohol, comes from the NHS and Alcohol Change UK, and the recommendation would be to consume no more than 14 units of alcohol spread across the week, and that should ideally be over 3 or more days, so no binge drinking, and try to aim to have at least 2 or 3 days where you're not consuming any alcohol at all. Now, that equates to 6 medium glasses of wine at about 13% strength, and 6 pints of beer at 4% strength. So obviously, all alcohol has different strengths. So bear that in mind. And there's no completely safe level of drinking. These are guidance, and pregnant women should avoid alcohol completely. Healthy eating and a balanced diet, and that's really what this is all about. It's having a balance across your food, making sure that you do eat more of the fruits and vegetables and pulses and grains as opposed to the fattier foods. Not saying that you can't eat any fatty foods or any sweet sugary foods, but limit them. So the healthy plate idea, you can see there, you've got half the plate is made up of fruits and vegetables, and then the other half with proteins and then whole grains, and you've got the other foods on the side that you can consume small amounts of. Another way of describing it increasingly is the Mediterranean diet. Now, the Mediterranean diet assumes that really on a daily basis, our main food should come from pulses, grains, things like that, and fruits and vegetables. That should be our daily food. Then you can have variable amounts of oils, particularly olive oil in moderation is quite good for you. A few times a week to maybe have things like fish and seafood, and again once a week or a few times a week dairy and poultry, and then limit to maybe monthly your consumption of red meat and sweet and sugary foods. Being physically active. So what does this mean? So the recommendation, again, from the World Health Organization and from the Department of Health in this country, is to aim for around 150 minutes a week of about, and that means about 20 to 25 minutes a day of being active. Doesn't necessarily mean going to the gym. It means being active. So going for a walk, taking the baby out, taking the dog out for a walk, just getting out into the fresh air. And being active is going to increase your bone density, it's going to calm your nervous system, it'll help reduce your weight, it gets you out into the fresh air, which is good for us anyway. Boosts our brain function, strengthens our lungs and strengthens our heart, and it also helps us fight infection, so raises our immunity. So it's about being physically active, not necessarily about exercise per se. And finally, I just wanted to talk about sleep. And I mean, obviously, this is a work-based piece of work. We're trying to support people who are working in social care to be healthy, and thinking, well, sleep is why are we thinking about that? But it's a balance, isn't it, between work, rest and play. And if you are tired, you're not going to be productive, and if you're tired, you're more likely to make mistakes. Now, everybody's different, but as a general rule, the guidance is to try and aim for about 7 to 9 hours of sleep a night. So it means that you need to factor that in to your daily routine. Don't worry if you do wake up in the middle of the night. That's normal. We go through periods of what we call very deep sleep and lighter sleep, and people often wake up in those lighter sleep periods. The important thing, though, is to be able to go back to sleep. And if you do have a bad night, don't be tempted to lie in. Make sure you stick to your routine so that you can then go to bed at a good time and keep that sleep pattern. The other thing, of course, is to try and limit things that are going to stimulate you too much. So caffeine particularly can have an impact on our sleep. So limiting the caffeine intake between 8 and 10 hours before you actually want to go to bed. So sort of from early afternoon onwards will help you have a better night's sleep. So looking after ourselves is really important, finding time to rest and relax. And I did this little breathing exercise in the introduction, and it's a very simple way of getting you to take lovely deep breaths. Now, we know that deep breathing will actually help reduce your blood pressure, so there are sort of physiological reasons to do this, but it also just helps you keep calm. And this box breathing is a very simple way. You breathe in for a count of 4, you hold your breath for a count of 4, then you breathe out for a count of 4, and you hold your breath at the top of at the bottom of the breath. And if you hold your hand on your chest and your abdomen, you can almost feel your lungs inflate. You hold your breath and exhale. I'll let you just do that while I'm talking. It just keeps you calm. You can almost feel your blood pressure. You can feel yourself relaxing. So thank you very much for listening. I hope that's been useful. Please tell us what you thought. There's a QR code on this screen. There'll also be one just before you sign up to the video. Do tell us, click on the link for the video recording option when you see the webinar. It's just a short questionnaire. It don't take you more than about 2 or 3 minutes to complete it. And thank you very much. I hope you found it useful, and hopefully you'll find some stimulation, some motivation to do some small changes and improve your health. So thank you very much. Goodbye.